recording. By you.
Hello, everyone. I'm Allison Harnden with the Office of Nighttime Economy. I'm here with Brett Kunesh, also with the Office of Nighttime Economy. We're really happy today to have a guest, Anne Marie Ellison, to talk to us about the Paid Sick Leave Act and some of the updates to that. If you're not familiar with the Office of Nighttime Economy, we're a resource for food, beverage, and entertainment businesses and a liaison for them and the communities where they operate. We have a monthly newsletter that will provide updates to rules like this from the city, the state, and the federal government if it applies to small business. And if you want to be on that newsletter, you can put your email in the chat and we'll add you. We do have another training coming up July 21st, and it is on CPR, AED, and Narcan on the north side at 2 o'clock on July 21st. If you want to join that too, let us know. You can, we'll put our email in there. If you want to contact us, we're happy to include you. But I'm going to turn it over to Anne Marie now, who's going to really have the bulk of the program. If you want to introduce yourself in the chat, if you are associated with the business and you want to know, want to let us know that, that's fine. If you don't, that's also fine. There'll be opportunity for questions at the end, but I'll turn this over to Anne Marie. Go ahead.
Thanks so much. I just want to say thank you to Allison and Brett for making this webinar possible. I think that it's been quite some time since I've gotten to do one of these, and it's actually kind of one of my favorite things is to work with folks who are building businesses in the city and trying to get into compliance to do the right thing and get their policies in order. So that's what we are going to talk about today. And I am here with you with the top 20 most frequent employer mistakes when it comes to putting together a Paid Sick Days Act policy. This is really focused on practical compliance. It's not going to turn you into an employment lawyer if you weren't one already. I am an attorney, but I don't think you should have to be one or hire one in order to get into compliance with this law. And so that's really what my hope is it's not to walk through every section of the ordinance line by line, but instead focus on the mistakes that happen most often, the questions we most frequently receive, and the issues that arise repeatedly when employers, or for that matter, employees, ask us to review policies that are pertinent to them. So my hope is that you'll leave with a better understanding of what the law requires, what employers where employers commonly run into trouble, and a short list of things that you can review right away as soon as you get back to your office to know that you have gotten your ducks in a row and feel secure in the policy you've created. So before we begin, just a few housekeeping matters. Please hold questions till the end if you can. As I mentioned, there's 20 of our most frequent mistakes here. So there's a real good chance that we will reach your question because you are not alone in having these questions. So many of the questions that we receive are repeat queries from people all around the city who have the same issue. I'd encourage you, if you do have questions, to jot them down or throw them in the chat, and we'll circle back for them at the end. This slide deck, I shared a PDF copy in the chat, and you should be able to download that. I will also, once I receive the recording from the Office of the Nighttime Economy, I will also post it on our website so that it is available 24/7 at all times, should you have the incredibly weird wish to watch this video again in the middle of the night when a question is bothering you. So if your question's really specific to your business, I'm going to ask that we discuss it afterwards so that we can spend this time addressing issues that affect everyone. But I'm also absolutely happy to connect after the presentation today, schedule a one-on-one conversation if you need assistance in reviewing a policy. Our email addresses and websites are all over the place throughout this deck, but you just so that it's said at least once up front, you can always reach us by email at paidsickleave@pittsburghpa.gov, or schedule time through our Microsoft Bookings page, which is linked elsewhere in the deck. Okay, so the Paid Sick Days Act was passed and signed in 2015. And we're still having this conversation. And so I think it helps a little bit to spend just a minute on how we got here. I hope this will be the shortest history lesson you get all year. The Paid Sick Days Act became law in 2015. Almost immediately, a lawsuit was filed by a group of food and beverage industry and hospitality industry based businesses. And so implementation was delayed, and the case went all the way to the Pennsylvania State Supreme Court. In 2019, the Pennsylvania Supreme Court upheld the ordinance, and the law took effect in 2020. In 2025, City Council adopted amendments that expand workers' rights under the ordinance. And those amendments became effective on January 1st of this year and increased several employer obligations. The reason I include this slide is because a lot of policies currently in circulation that we're seeing that people are still using were drafted before implementation, before the amendments, or both. And so employers might be relying on language that was compliant when they first drafted the policy, or at some other point since then, but that no longer reflects what the current requirements are. So that brings us to the most significant recent changes. What's new in 2026? The accrual rate has increased to 1 hour for every 30 hours worked. Previously, it was 1 hour for every 35 hours worked. The annual accrual cap requirements increased so that larger businesses with 15 or more employees, are required to give their workers 72 hours per year in paid sick leave. And smaller businesses with fewer than 15 employees, are required to provide 48 hours per year to their employees. And so even policies that maybe last year, I was pleased to designate as a safe or thriving workplace in the city of Pittsburgh, meaning that they complied with the requirements of the law or even exceeded them in the context of a thriving workplace, may still need to go back to the drawing board a little bit. It shouldn't be too many major edits, but there might be some required. So first, I'd like to talk with you about the top 20 Paid Sick Days Act policy mistakes. When employers hear the word compliance, a lot of people think about whether or not a handbook has the right policy language, and that matters. But compliance is bigger than that. Most compliance problems fall into 5 general categories: coverage, accrual, use, retaliation, and administration. A compliant program means covered employees receive leave, that their leave accrues correctly, employees can actually use the leave when the ordinance requires, attendance policies don't punish employees for using protected leave, and required records are maintained. Many of today's examples involve situations where the handbook looked like it was totally compliant at first glance, but then in actual practice, there were problems. And so that's why we're going to spend time talking about payroll systems and attendance systems, scheduling practices, and record keeping, in addition to policy language. So let's start with coverage. And before we discover who is covered, we need to answer a more basic question: which law applies? common mistake number one is uncertainty about what the applicable law is or which enforcing agency is the right one to reach out to. That might sound small, but in practice, it creates a surprising amount of confusion. Many employers are uncertain whether they should be looking at city requirements, county requirements, or both. We frequently see policies that contain outdated contact information or information for the county when it ought to be for the city. We see policies that reference Allegheny County requirements when they're attempting to describe the city's ordinance. And occasionally we see policies directing employees to the wrong agency altogether in the event of a complaint. So one important thing to remember is that the city and county both have paid sick leave laws. Those laws are related, but they're not identical. Employers located inside Pittsburgh city limits generally need to comply with both. Employees should be directed to contact the agency for the issue being discussed, and if the Paid Sick Days Act that the city has applies, then they should come to our office, the Office of Equal Protection. One of the simplest compliance reviews you can perform is checking your handbook's contact information. Make sure links work, make sure phone numbers are current, make sure references to city and county requirements are accurate. Sometimes one of the easiest compliance fixes is just updating a web page or a handbook reference. And if you're not sure whether a workplace is located inside city limits, the next slide or slides provide a useful tool. The important point is that compliance starts with knowing which laws apply. And once we've determined which ordinance applies, the next step is who's actually covered under that law. The city maintains a GIS mapping tool that can be used to help answer a very basic but important question. Is the location where the work is done by your employees done inside city limits? So you can go to the website, and we included a link in the deck. If you enter the address where the work is performed, you can determine whether or not a workplace is located inside city limits. And if it is, then the city's Paid Sick Days Act applies. That doesn't eliminate other obligations. It just lets you know that you need to comply with the city's act. And again, some employers, maybe even most employers, may have responsibilities under the Allegheny County law as well. So who is actually covered? Once you determine that your work site is inside city limits of Pittsburgh, who's covered? Common mistake number two is excluding covered employees. This is one of the most fundamental mistakes that we ever encounter. If an employer incorrectly excludes a covered employee, every other compliance discussion becomes irrelevant because the employee never receives leave in the first place. Some of the most common examples include excluding part-time employees, creating eligibility requirements that don't exist in the ordinance, or assuming that very small employers are exempt. They're not. The key thing to remember is that eligibility isn't determined by whether an employee is full-time or part-time. Employer size does affect how much time must be provided, but it doesn't determine whether or not employees are covered by the City Act. The ordinance generally covers employees who work at least 30 hours within Pittsburgh during a year, unless a specific exemption applies. So that's not a lot of time. Basically, the instant that you have worked 30 hours, you are then entitled to 1 hour of paid sick time. And so once you hit that mark, even though it's fairly small over the course of a year, your employer will have an obligation to you to provide paid sick leave. When we're reviewing a policy, coverage is often the first thing that I check because a mistake there affects everything else. This is another area where employers frequently misclassify workers, and that's seasonal employment. So this is common mistake number 3, misapplying seasonal employee exceptions. Another area creating confusion is seasonal employment. Many employers think that a temporary employee is automatically a seasonal employee, and that's just not so. The ordinance has really specific language around seasonal employment, and that exception has specific requirements. Seasonal status generally requires that employment lasts no more than 16 weeks and that a start date and end date be established in writing beforehand. So in practice, what I often see is an employer using temporary or seasonal, part-time sort of interchangeably, but they're not interchangeable under the ordinance. Somebody hired for a short project isn't necessarily seasonal. Someone working part-time isn't necessarily seasonal. And someone working seasonally is not automatically exempt just because the employer calls them seasonal. If you intend to rely on a seasonal exception, you need to make sure that the employment arrangement actually meets the requirements and that the documentation supports the classification. Once we've determined who's covered, then we talk about when leave begins accumulating. And that takes us to common mistake number 4, delaying accrual during probation. I often tell employers to think of accrual and use as completely separate concepts because that's exactly what the ordinance does. Many employee handbooks have language that says something along the lines of no sick leave accrues during the introductory period or the probationary period. And that's where the problem begins. The ordinance allows employers to delay use of paid sick time until the 90th day of employment, but accrual has to start when employment begins. So those are different things. The easiest way to remember it is you accrue on day 1, but you don't use until day 90. And if that's the only thing you remember from this slide, that's okay with me. A lot of employers are trying to accomplish something reasonable here. They don't want a brand new employee joining their staff and then immediately taking a leave. But the ordinance already addresses that concern in a different way, and you don't need to delay accrual to achieve it. What you can do is start accrual on day 1, but prevent use of that time until day 90. And that's permissible under the ordinance. Now that we've discussed coverage, let's move into the second major category of mistakes, accrual. Common mistake number 5, using the accrual rate for a smaller business. This mistake usually affects employers with multiple locations, from what I have found. A lot of employers look only at the number of employees working at their particular Pittsburgh location. For example, a manager might see 10 employees at a local site and assume that the lower annual accrual cap applies, meaning 48 hours rather than 72. But the ordinance takes a broader view. For purposes of determining which annual cap applies, employers should be looking at total employment worldwide. So that means a business could have only a handful of employees in Pittsburgh, but still be required to provide leave at the higher annual level because the organization as a whole exceeds the 15 employee threshold. And this is one of the reasons I encourage employers not to rely just on local headcounts when reviewing compliance. Closely related to workforce size is another issue we continue to see after the expansion amendments. Common mistake number 6, using incorrect annual accrual caps. This mistake has become more common since the expansion amendments last year. Many employers updated their policies years ago, maybe even participated in our policy review through the Office of Equal Protection and got the stamp of approval and haven't revisited them since. And that makes total sense. It hasn't actually been all that long. But as a result, we are still seeing policies that maybe reference the pre-expansion annual accrual limits and therefore violate the current law. The current annual accrual requirements are 48 hours for employers with fewer than 15 employees worldwide and 72 hours for employers with 15 or more employees worldwide. And owners don't count as employees. But do notice that I said worldwide. So we're not just looking at employees working inside the city of Pittsburgh for the purposes of determining how much time an employer needs to provide. So when you're making that threshold inquiry, employers should review how workforce size is measured under the ordinance. One practical recommendation is don't assume your handbook vendor automatically updated your policy. Don't assume that your payroll software automatically updated your policy. You're going to have to verify it manually. A surprising number of compliance issues originate from employers believing that a system update occurred when it didn't. Related to annual caps is the question of how employees accrue leave in the first place, leading us to common mistake number 7, using outdated accrual rate. This is probably the simplest amendment related issue we'll discuss today. Prior to the expansion amendments in summer of 2025, the ordinance used a different accrual rate. Today, employees accrue 1 hour of paid sick leave for every 30 hours worked. That sounds straightforward, but we still routinely encounter policies that reference the previous rate because nobody's reviewed the language recently. If you're unsure whether your policy has been updated, this is one of the easiest places to check. So look for the accrual formula in your policy. If it doesn't say 1 hour for every 30 hours worked, you need to take a closer look and you might want to update the language in your policy. Again, this isn't usually a case of employers intentionally violating a law. More often, it's a policy that just hasn't been revisited since the law changed, but that doesn't change an employer's obligation to comply with it. Now let's move from how leave is earned to how employees can actually use it. Common mistake number 8, requiring written permission instead of oral notice. This appears constantly. A policy says employees must obtain approval before using sick leave, or all leave requests must be submitted through the portal. And that sounds pretty reasonable. That's a sort of the normal way that work is done. Employers want to know when employees are going to be absent. And that's reasonable too, but notice and approval are not the same thing. The ordinance allows employers to require notice, and what creates problems is when that notice starts getting treated a little bit more like permission. An employee who has unused accrued time in their balance and wakes up sick first thing in the morning, an hour before their shift starts, might not be in a position to negotiate with their supervisor about whether or not they're allowed to use protected leave. The employee's responsibility is generally to notify the employer according to the policy, and the employer's responsibility is to administer that leave appropriately. An oral notice must suffice. It's specifically written into the ordinance. Employers can encourage use of online systems and portals, and I recommend very strongly having a backup in the event that a person is not able to speak live with a member of your staff, whether it's the owner or the manager. But those systems can't be the only way that employees can exercise those rights. They have to also be able to just tell you, whether by a phone call or in person, face to face. A closely related issue has to do with scheduling. Common mistake number 9, requiring employees to find their own replacements. This is one of those provisions that appears in handbooks a lot because it's existed for years. It's especially common, I think, in the food and beverage industry. It happens a lot in restaurants. Policy says something like, if you need to miss work, you're responsible for finding someone to cover your shift. The problem with that is that staffing is ultimately a management responsibility. So employees provide the notice, but management handles the scheduling. Think about how this works in practice. An employee wakes up sick. Maybe they don't know which of their colleagues or coworkers are available. They might they probably don't really have access to the entire business's schedule, and they might not even be physically capable of making a whole bunch of phone calls while they're sick. Pardon me. Imagine, for instance, if this is somebody who's sick and waiting in the waiting room at the emergency room. A policy that conditions leave on finding replacement coverage creates barriers to use, and that flies in the face of the spirit underlying the Paid Sick Days Act. As a practical matter, employers need to separate notification requirements from staffing requirements. The employee tells you that they need leave, and management determines how to fill the shift. That's not a responsibility that the Paid Sick Days Act permits to be offloaded onto the person using paid sick time. A similar issue appears when employers try to block leave during busy periods, sometimes called blackout periods. Common mistake number 10, prohibiting leave during blackout periods. Many employers are familiar with blackout periods for vacation requests. For example, no vacation during inventory, no vacation during the holiday season, no vacation during major events. Those restrictions might be appropriate for discretionary PTO, but paid sick leave is different. Illness doesn't follow a business calendar. Employees don't schedule flu symptoms around inventory counts, and they don't coordinate medical emergencies around holiday staffing plans. And that's why we often encourage employers to think separately about vacation policies and paid sick leave policies. A rule that works perfectly for vacation scheduling might create real problems when applied to protected sick leave. So the practical question here is, if an employee genuinely becomes ill during your busiest week of the year, can they still use leave? If the answer is no, the policy needs a rewrite because it violates the law. Let's talk now about one of the most common drafting problems we see. Common mistake number 11, defining permitted uses too narrowly. A lot of policies treat paid sick leave as though it only applies when an employee personally is ill. And the ordinance is just a lot broader than that. Paid sick leave can be used for preventative care, it can be used for diagnosis, it can be used for treatment, it can be used to care for covered family members. It might even be used in public health related circumstances like the pandemic that was underway when this law really went into effect. One of the easiest self audits that you as an employer can perform is to compare your policy to the ordinance. Does your policy describe all of the ways that leave can be used, or does it only list illness? A policy that says employees may use sick leave when they are sick may sound compliant at first glance, but it often leaves out several other protected uses. So when in doubt, broader and clearer language is usually better. Closely related to permitted uses is the question of who employees can use the leave to care for. And again, this is an area where the ordinance is quite broad. And this issue surprises many employers. A typical handbook definition of family might include, spouse, parent, child, and stop there. But the ordinance uses a much broader definition. It includes domestic partners, it includes grandparents, it includes grandchildren, it includes certain other sort of caregiving relationships not bound by blood. It includes individuals standing in loco parentis. And because many employers use generic HR templates, family definitions are frequently incomplete. So a policy can get everything else right and still create compliance problems because the family definition is too narrow. And this is another area where I really encourage employers to look directly at the ordinance rather than relying on assumptions about what's compliant under the law, and compare the list in your policy to the way that it's written in the ordinance. Policies can sometimes create barriers. One of the ways that happens involves notice requirements. So common mistake 13, requiring too much advanced notice. Employers understandably want advance notice whenever possible. It helps with scheduling, it helps with staffing, it helps everybody make the business run. But the problem arises when notice requirements are unrealistic. Sometimes we see policies that require 2 weeks notice, like we talked about before, which would make total sense in the context of vacation. Before leave can be used. It really just doesn't work for illness. So the Paid Sick Days Act recognizes that some absences are foreseeable and some aren't, and it provides ways to handle both situations and sort of everything in between. If an employee knows about a scheduled medical appointment in advance, reasonable advance notice may be appropriate. The ordinance specifically allows employers to require reasonable notice for foreseeable uses of leave, but not more than 7 days before that leave begins. If an employee wakes up sick unexpectedly, the situation is different. The ordinance contemplates a good faith effort on the employee's part to provide notice as soon as possible under the circumstances. And that might differ depending on the employee's current circumstances. A key question to keep in mind is, does the notice requirement make using leave easier or harder? If it's harder, you might need to revisit the language that you're using. Because we don't want policies that disadvantage or implicitly disapprove of use of the protected time. One other usage issue frequently appears in payroll systems. Common mistake number 14, restricting leave to full shift increments. This issue often begins as a payroll convenience. An employer wants simple bookkeeping, and so the policy says employees may only use leave in 8-hour blocks or 4-hour blocks or full shifts. But the ordinance, which is what's binding here, takes a different approach. So the Paid Sick Days Act says that employees should generally be permitted to use leave in the smallest increment the employer's payroll or bookkeeping system can track. Oftentimes with products like ADP or Homebase, that's a 0.25 hour or 15 minutes. Some will go lower and do a 1/10 of an hour at a time, but whatever the lowest increment your system will permit is the one to use. And even if your system is more challenging than others, the maximum required increment is 1 hour. So the use of paid sick time shouldn't require workers to use more time than they actually need, simply by virtue of the scheduling system. Employers should avoid rounding up leave usage in a way that requires employees to use more than they actually needed or more than they actually used. So think about a typical doctor's appointment, right? Like many appointments don't require a full day off. Many don't require a full shift off. And the position of the act is that employees should not be forced to use substantially more leave than necessary just because of what the bookkeeping system prefers. One practical recommendation is to review how your payroll system is currently configured. A lot of employers discover that the software itself is creating restrictions that they actually didn't intend. And that takes us to retaliation, another area where employers often have good intentions but accidentally create liability. Common mistake 15, requiring too much documentation. The Act explicitly disallows practices that penalize workers or make it more difficult to use paid sick time. This is one of the most common policy issues we encounter. A lot of employers assume that because an employee is requesting leave, they can automatically demand documentation. And as a result, we often see policies that require doctor's notes for every absence, or policies that require documentation after 1 day, or policies that require medical documentation before leave can be approved or payment can be issued. Sometimes policies go even further and request diagnosis information that is not really necessary to administer leave. But the Paid Sick Days Act is considerably narrower. Documentation requirements are limited. It usually can't be required unless the employee has missed 3 consecutive full days. Even when documentation is appropriate, employers should focus on what's really necessary to administer leave rather than collecting unnecessary medical information. A note from a provider simply saying time off of work is necessary for my patient so-and-so should be sufficient. Another issue that deserves attention here is confidentiality. If an employer receives medical documentation, it should be treated appropriately, maintained confidentially. A lot of employers focus on getting that documentation, but spend less time thinking about how they're going to store it, but both matter. Think of HIPAA. One practical recommendation is to review your attendance policy and your sick leave policy together. A lot of problematic documentation requirements originate in attendance policies rather than in sick leave policies. And that might require a little bit of tweaking. I've got an example next that helps illustrate how this rule works in practice. Here's a common scenario. An employee misses work Monday, misses work Tuesday, returns Wednesday, but leaves early. Can you require documentation? The answer is no. Why? Because the employee hasn't missed 3 full consecutive days, and that's what the ordinance requires. This is one of those situations where employers often think in calendar days, while the ordinance maybe uses a more specific standard. So the easiest way to avoid mistakes here is to evaluate the actual absence against the ordinance's requirements before automatically requesting documentation. So when in doubt, slow down. A surprising number of complaints begin with documentation requests that were made reflexively rather than intentionally or out of necessity. And documentation issues often overlap with retaliation. Common mistake number 16. Penalizing the use of paid sick leave. At this point, we've spent a whole bunch of time talking about how leave accrues and how employees use it, but now we need to talk squarely about retaliation. One of the most common mistakes we encounter is treating lawful use of paid sick leave as a disciplinary issue. Sometimes the policy uses phrases like pattern of absences, repeated absenteeism, attendance occurrence, or repeated absences. Terminology varies, but the problem is that protected leave shouldn't become the basis for punishment or even denial of privilege. If an employee uses paid sick leave in accordance with the ordinance, that use generally can't be counted against them. Employers should be especially careful when attendance systems automatically assign points or trigger discipline. Sometimes the issue isn't the written policy either. Sometimes it's the way the software is configured. The easiest question to ask is, would the employee be worse off because they used protected leave? And if the answer is yes, the policy needs an edit. A simple self-audit can help identify some of these problems. One of the most important points I'll make today is that retaliation problems often begin in attendance policies rather than in sick leave policies. An employer may have a perfectly compliant paid sick leave policy and still create significant liability risk through their attendance practices. So let's do a quick self-audit. If an employee uses paid sick leave, do they receive attendance points? Do they move closer to discipline? Do they lose a bonus? Do they lose an attendance incentive? Do they suffer any negative consequence? If the answer to any of those questions is yes, the policy needs revision to comply with the law. Protected leave should not become the basis for punishment. And this is why I always encourage employers to review attendance policies and leave policies together, because they should work together. They shouldn't contradict each other. Another retaliation issue surprises many employers. That brings us to common mistake 17, prohibiting use of paid sick leave after notice of separation. As I said, this can be surprising to folks. A policy might state once an employee submits a resignation notice, no PTO may be used during the remaining employment period. That type of rule might work for certain categories of discretionary leave, like vacation, but paid sick leave, again, is different. Because of the Paid Sick Days Act, an employee remains an employee until employment actually ends. And if that employee experiences a qualifying need for paid sick leave before separating from employment, that leave generally remains available. In other words, giving notice doesn't eliminate rights that exist during the rest of employment. One thing to remember, though, is that the ordinance doesn't require payout of unused accrued sick leave at the time of separation. They're separate issues. The employee can use accrued leave while employed, but the employer doesn't have to cash it out afterwards. That takes us from retaliation to administrative issues that can be challenging. Common mistake number 18, misunderstanding carryover. I think this is maybe the most frequent question that we get, and it's one that we get not just from business owners, but also from HR specialists and law firms representing larger businesses, just because of, I think, the way the language appears in the ordinance doesn't maybe offer all the clarity that people might hope. So this is a really important item in this presentation. This is about carryover, carryover of unused accrued paid time off. Some of the most common questions we get are, if leave carries over, does accrual stop? When does accrual restart? Can employees carry over more leave than they're permitted to use? How much leave has to be available at one time? And how exactly am I supposed to track all of this? The reason carryover becomes confusing is that employees are often trying to manage several different concepts simultaneously. The current balance, the annual accrual, the annual use, the carryover, those are all different metrics. And many compliance problems occur when they're treated as if they're interchangeable. Before we talk through an example, I want to emphasize one important point. Carryover and future accrual obligations aren't the same thing, and they don't zero each other out. The distinction is actually what drives most of the analysis. So let's work through an example. Imagine a small employer, 4 employees. The employer uses the accrual method when providing paid sick leave to staff. During the first year, an employee accrues 48 hours of leave. They use 8 hours and they have 40 hours left at the end of the year. So now the employee begins year 2 with a 40-hour balance because it carries over. The employee continues working. The employee continues accruing leave. Eventually, the employee reaches the applicable cap, which in this case, because it's a smaller business, is 48 hours per year. At that point, additional accrual may have to pause. The important thing to understand is that carryover didn't eliminate future accrual obligations. The employee continued earning leave after entering the new year. So let's look at what happens next. Once the employee reaches the applicable cap, accrual can pause, but that pause doesn't have to be permanent. It's tied to the employee's balance. So suppose the employee later uses 8 hours. The balance decreases and goes to 40. Once the balance decreases, accrual obligations can resume. The employee begins accruing paid sick time again until the balance again reaches the cap. And then accrual again pauses. And this cycle might repeat multiple times over the course of a year's employment, which is why I often describe carryover administration as sort of a stop and start process. It might pause, it might resume, it might pause again. The trigger is going to be the balance and the employee's worked hours, not necessarily in this instance the calendar year. The key takeaway for you is that unused time carries over under the accrual method, and accrual obligations continue according to the ordinance, and employees don't have to lose their carried over time. At the same time, employers are not required to provide just unlimited access to leave. The ordinance establishes specific caps and obligations that interact with one another, including saying at one specific point that an employee is never required to be permitted access to more than the statutory cap of 48 hours per year at any single time. So that's the reasoning behind why it would pause when it hits 48, because an employee can't have access to more time than that at once. But once they use some of it, then that problem vanishes. Okay, let's move from carryover to record keeping. Common mistake number 19. Failing to provide leave balance information or retain records. Many employers think about paid sick leave primarily in terms of accrual and usage. Employees often think about something that's much simpler. How much time do I have left? When employees can't determine their leave balance, they're quickly frustrated. And one of the best practices we encourage is making those balances easily accessible. That might be a pay stub, a payroll portal, a timekeeping system to which everyone has access. Because if the information is only available to the person who's doing the bookkeeping, and an employee has to seek out that individual in order to know what their balance is, they're not in a position where they're really making informed use of their guaranteed paid time off. Another issue involves record retention. Under the Paid Sick Days Act, employers should be maintaining records for at least 2 years. And that's really simple. When questions arise, the documentation matters. Good records protect employees. Good records also protect employers. And if a dispute occurs, accurate records often become the most important information or evidence available. One final administrative issue is often overlooked during ownership changes or employee transitions, and this is our 20th common mistake. And that is when business or employment changes are thought to zero out accrued time. This is a mistake we encounter most often during ownership transitions or reorganizations, sometimes employee status changes. An employer purchases a business, the same employees continue working, and someone assumes everyone starts over with a clean slate. Or an employee experiences a short-term separation and then returns. Again, someone assumes that the previously accrued leave disappears. But that's not what the ordinance says. Generally speaking, accrued time should not disappear just because a business changes hands or because an employee experiences a short interruption in employment. If an employee is rehired within 6 months, previously accrued and unused paid sick leave may have to be restored to that employee. This is one reason that accurate record keeping matters so much. Without good records, it becomes really difficult to determine what balances should be reinstated. An important clarification, I know I've mentioned this before, but it's not really something I can say too many times. Employers still are not required to pay out unused accrued sick leave when employment ends. So, where to start next? 4 things that you can check tomorrow. If you can only take away 4 action items from today, make it these. First, review your handbook. Do you have an explicit paid sick leave policy? Has it been updated for the 2026 amendments? Second, review carryover administration. Can payroll accurately track carried over time? Can employees understand what they're seeing on their pay stubs? And are records being retained appropriately? Third, Review leave usage rules. Can employees actually use leave when the ordinance requires? And fourth, review attendance policies. Are attendance rules creating barriers or penalties associated with protected leave? If employers focus on these four areas, they will identify many of the most common compliance issues that we see. Administrative requirements employers often miss. Many employers devote significant attention to leave accrual and usage, and that makes total sense. But administrative compliance matters too. Some of the most frequently overlooked requirements include maintaining a written policy, providing language access where appropriate, maintaining records, providing balance information, using proper increments for leave, and posting required notices. None of these are particularly complicated. The challenge is just remembering that they exist. A comprehensive compliance review should evaluate both substantive requirements and administrative requirements. And before we wrap up, I want to address a few issues that frequently create confusion for employees as well. Employers aren't the only ones who get confused by the ordinance. Employees sometimes misunderstand it too. One common misconception is that the ordinance creates a completely separate bucket of leave. That's not necessarily true. Another misconception is that the name of the leave controls compliance, but it doesn't. The ordinance generally focuses on how leave functions rather than what it's called. Employees also sometimes see multiple leave categories displayed in payroll systems and assume something improper is happening. In reality, some payroll systems separately track protected leave, PTO balances, and bookkeeping entries for compliance purposes, and that can look unusual without necessarily being incorrect. It can sometimes look to an employee like their time is being double dipped into. So one thing we recommend is clearly communicating how all these systems and processes work to staff from the first time you employ them. This can avoid a lot of conflict later when employees are looking at their pay stubs. A compliant PTO policy that you have in place might already satisfy the ordinance. An employer isn't required to create a second bucket of leave just because the ordinance exists. What matters is whether employees can use the leave in accordance with the ordinance's requirements. So, can it be used short notice? Can it be used without finding replacement coverage? Can it be used during periods of unexpected illness? Can it be used for all protected purposes without retaliation? If the answer is yes, then the existing PTO policy may already satisfy the ordinance. And this is another reason why we encourage employers to focus on how they administer the paid leave rather than what they call it. A policy called PTO can comply, while a policy called sick leave can fail. The name alone doesn't answer the compliance question. Let's finish with a final self-audit. One of the best compliance tools available is clarity. Clear policies reduce misunderstandings, complaints, and risk. If you're still unsure and you need help getting your policy there is help available. A slower compliance check would involve our office, the Office of Equal Protection. We review employer policies. We provide feedback regarding potential compliance concerns, and we also recognize businesses through our Safe and Thriving Workplaces initiative. One thing I encourage employers not to do is wait. There's often a queue. If you're planning policy revisions, begin now, implement changes now, and request feedback right away. The earlier a problem is identified, the easier it generally is to fix. I'd also like to leave you with a few resources. The Office of Equal Protection website contains a variety of them, including the ordinance, the administrative guidelines, required notices, complaint information and forms, the Safe and Thriving Workplaces information, and other things. And as I mentioned, this webinar will go up there very quickly. But if you need assistance, contact us, email us, schedule a call. Reach out before a problem becomes a complaint. We would much rather help employers achieve compliance than address avoidable violations later. And that brings me to the end of what I have prepared to talk with you about today. I just want to remind you, I know that we've talked about a lot of substantial information. I hope that this will have begun to demystify the ordinance and give you a practical framework for reviewing your policies. Most compliance problems are preventable. Most of them are fixable, and a lot of them begin with just a handful of recurring mistakes. Thanks so much for being here, for your attention. I'm happy to take questions now or one-on-one later.
Anne-Marie, thanks so much for that really thorough explanation. And I really love that you gave some of the examples where it might apply. I think it's going to be a really great resource for people as a recording to go back to. You're welcome. Anybody that has a question, go ahead and type it in the chat. We'll give you a little time to do that. And like Anne-Marie said, this recording generally takes about 24 hours to be available to us. We'll get it to her as quick as possible. We'll also put it on our webpage if you know ours. We really appreciate all the people that have come here. Is there anything else that you want to add while people are potentially typing questions, Anne-Marie? It seems like you really covered everything so well, and you gave all these great resources.
Thank you. I appreciate it. I just want to say thanks for having me here. I really appreciate the opportunity. These are always interesting to do. I can sort of talk about the Paid Sick Days Act in my sleep at this point after years of working on it, but it's really always helpful to connect with the people who are using it the most. So I really want to thank you and Brett for the opportunity to share out, and I hope we do it again.
Yeah, I just really appreciate so much that you guys really focus on compliance, and that you offered the service of letting people or reviewing their policy. I mean, that really shows that we're really not, the city isn't really out to like get you. We're out there to get you into compliance. So okay, it looks like there is one question here. As long as we have personal leave and apply it accordingly to be compliant with the act, we are okay?
As I want to couch this so that because this is kind of a vague question, but I think the answer is probably yes, as long as a couple of qualifications are met. It doesn't, as I said, it doesn't matter what it's called. So calling it personal leave doesn't have any impact on it at all. What matters is that if you are using the accrual method, that the accrual rate is no less than 1 hour earned for every 30 hours worked. And that you are permitting employees to reach the statutory accrual caps of either 48 hours if you're a smaller business, or 72 hours per year if you're a business with more than with 15 or more employees. And as long as they can use it under the same conditions and with the same consequences as the Paid Sick Days Act describes, then it should be okay no matter what it's called. It really has to do with the conditions under which it can be used, and the numbers for both the rate of accrual and the maximum. I hope that answers the question. If not, happy to take it offline and keep chatting.
Could you back up the slide to show your contact information or the website, email? We can also send it with our recap of this, but it looks like, you've done such a thorough job. I think the questions, it's probably a lot to digest too. And a lot of people don't want to really go on record asking their questions. So we respect that. And if you want to contact Anne-Marie, her and her office are happy to help you solve your issues. So
absolutely.
Yeah. Well, thank you so much, Anne-Marie, and have a great rest of your day.
Thanks, you too. Thanks, everyone.
Bye.
Bye-bye.